question is to the Minister of Health. Does he stand by all his recent statements regarding health services?
Mr. Speaker.
The Honourable Dr. Nick Smith.
Mr. Speaker, on behalf of the Minister of Health, yes, including the very important statement that health expenditure as a proportion of GDP is at the highest level ever in New Zealand history.
The Honourable Ruth Dyson.
Does he think that elective surgery is a frontline health service? And if so, how can he allow Wellington Hospital to close their theatres for a week?
Apologise to the member. It's perfectly acceptable for visual aid to be used by the member and therefore the person assisting the bench, but it's not acceptable for them to be shown from other benches. The Honourable Ruth Dyson.
Does he think that elective surgery is a frontline health service? And if so, how can he allow Wellington Hospital to close their theatres for a week to save money, delaying surgery for 150 Wellington residents?
Mr. Speaker,
Honourable Dr. Nick Smith.
Mr. Speaker, I note that there was 11,000 more elective surgery operations done in the first year of this administration, and furthermore that the increase in expenditure will allow even more elective surgery next year. I'd also note that the health board that the member refers to has actually had a substantive increase in their funding in the budget.
The Honourable Ruth Dyson.
What district nursing services will be available to people in Palmerston North who have blocked catheters, oxygen supply breakdowns, or those dying in pain if Mid-Central District Health Board goes ahead with its proposal to completely axe the entire night shift from district nurse services?
The Honourable Dr. Nick Smith.
Mr. Speaker, I note that the increase in the level of funding for the Mid-Central District Health Board is $39 million over both last year's budget, of which $13 million is in this year's budget, and with that improved level of funding provided by government, the government does have confidence that first-class health services can be provided for the people of the Mid-Central District.
Nikki Wagner.
Speaker. Thank you, Mr. Speaker. To the Minister of Health, how much of the extra funding for next year that the government has announced is going to district health boards?
The Honourable Dr. Nick Smith.
Mr. Speaker, in the next financial year, DHBs will receive an estimated $407 million, taking the proportion of GDP that has been spent on health to the highest level ever. I think that demonstrates the level of commitment that this government has to our important public health services.
The Honourable Ruth Dyson.
How can he justify the cut to the weekly visit from a nurse to Paraparaumu College? Firstly, cutting it back to fortnightly, and from the 1st of July, cutting it completely.
The Honourable Dr. Nick Smith.
Mr. Speaker, I'd draw on the considerable experience of Annette King, who, as Minister of Health, said that members, where they have got individual cases, should raise them directly with the Minister's office, rather than in a very broad question that covers such a wide range.
The Honourable Ruth Dyson.
Given that Associate Minister of Health, the Honourable Tariana Turia, said that the closing of Kenepuru's emergency department between the hours of 11 p.m. and 8 a.m. would, quote, put people's lives at risk, can we now expect the government, of which Mrs Turia is a member, to get involved in this issue and ensure that that service is not cut?
The Honourable Dr. Nick Smith.
Mr. Speaker, a huge faith is had in Tariana Turia because she is such an effective Associate Minister of Health. On the specific issue of the Kenepuru Accident and Medical Clinic, I can advise that Capital Health have no plans to make changes to the services there, and in fact is delivering a lot more services. 4,000 more outpatient services this year have been provided from Kenepuru, and I think that's something of which we should all welcome.
Question number 3, Aaron Gilmore.